Cinnamon, a spice commonly found in everything from morning coffees to baked goods, has long been admired for its pleasant aroma and purported health benefits. However, a recent study from the University of Mississippi has raised significant concerns about its potential interaction with prescription medications, particularly in high doses. While the occasional sprinkle of cinnamon in your latte or oatmeal may not pose any immediate threats, the study warns that excessive consumption, especially in supplement form, could have dangerous consequences. At the heart of the issue is cinnamaldehyde, the compound responsible for the characteristic flavor and smell of cinnamon. Researchers have found that cinnamaldehyde can activate certain receptors in the body that speed up the breakdown of various medications. This acceleration could potentially reduce the effectiveness of those medications, making them less potent and therefore less able to manage or treat the conditions they're prescribed for. For individuals relying on medications for serious health conditions, such an interaction could be hazardous. One of the most concerning findings from the study is the risk posed by high doses of cinnamon supplements, particularly for people who are unaware of how these supplements might interfere with their prescribed treatments. Overconsumption of cinnamon in supplement form could lead to a rapid clearance of prescription medications from the body. As a result, the medication might not stay in the system long enough to be effective, leading to worsened health outcomes for individuals who already rely on these medications. Shabana Khan, a principal scientist involved in the study, noted the dangers of taking these supplements without proper consultation with a healthcare provider. The combination of high-dose cinnamon and prescribed drugs could undermine the intended benefits of the treatment, leading to serious consequences. The risks of cinnamon consumption are not limited to its ability to interfere with medication. There is also the issue of coumarin, a compound found in high amounts in cassia cinnamon, the most common type of cinnamon sold in supermarkets. Cassia cinnamon, often labeled simply as ground cinnamon, contains a significant amount of coumarin, a substance that has blood-thinning properties. For individuals taking blood-thinning medications, such as warfarin, the anticoagulant effects of coumarin could enhance the risk of bleeding, potentially leading to dangerous health complications. While true cinnamon, which comes from Sri Lanka, contains significantly less coumarin and therefore poses a lower risk, the more widely available cassia cinnamon remains a common concern. The study authors emphasize that people using cinnamon in large amounts or in supplement form should be cautious, particularly if they're taking blood-thinning medications or have conditions that require such treatments. The presence of coumarin in cassia cinnamon increases the likelihood of dangerous interactions, making it essential for consumers to understand the differences between cinnamon types and their potential effects on health. Another important consideration is the growing popularity of cinnamon supplements, which have been marketed for their purported health benefits, including blood sugar regulation and anti-inflammatory properties. While these benefits may be real, the lack of regulation in the supplement industry means that consumers often turn to products that contain high doses of cinnamon without fully understanding the risks. As with any supplement, there is no guarantee of safety, and the potential for harmful interactions with prescription medications is high. For individuals with chronic health conditions, such as diabetes, hypertension, or arthritis, the temptation to turn to cinnamon as a natural remedy could be dangerous without proper oversight from a healthcare professional. The study also highlights the broader issue of supplement use, particularly in people who already rely on prescription medications to manage their health. Supplements are not regulated in the same way as pharmaceutical drugs, meaning that their safety and efficacy are not always guaranteed. Adding supplements like cinnamon without consulting a healthcare provider could not only lead to dangerous drug interactions, but also worsen existing health conditions. Individuals with chronic illnesses, including cancer, HIV, and obesity, should be particularly cautious, as their medications may be even more susceptible to interference from external compounds like cinnamon. In light of these findings, the best advice for consumers is to exercise caution when incorporating cinnamon into their diets, especially in supplement form. While cinnamon may offer certain health benefits, it is not without its risks, particularly for those on prescription medications. The potential for adverse interactions underscores the importance of consulting with a healthcare provider before adding cinnamon or any other supplement to your routine. By doing so, Individuals can help ensure that their treatment plans remain effective and that they avoid putting their health at unnecessary risk. Ultimately, the message is clear. While cinnamon may seem like a harmless spice, its potential to interfere with prescription medications should not be underestimated. Whether it is speeding up the breakdown of drugs or increasing the risk of bleeding, the risks associated with high-dose cinnamon intake should be taken seriously. In a world where supplements and natural remedies are often marketed as safe alternatives to traditional medicine, it is crucial for consumers to be fully informed about the potential dangers of mixing these substances with prescription treatments. By exercising caution and seeking professional advice, individuals can enjoy the benefits of cinnamon while minimizing the risks to their health.